All right. At this time, I would like to introduce Mayor Kriseman to get us started.
Thank you, Kim. First off, thank you to our healthcare and medical experts who have taken time out of their schedule to participate in this town hall today. Thank you to Amber and your team and Chris and your team. To all of our employees that are watching this live, and to those who will be watching it via recording, or anyone else for that matter who watches it, our hope today is that we are able to dispel some myths that might exist, to provide greater clarification related to vaccinations and the impact of vaccinations, to educate you and to make sure that you have the best information possible, so that you can use that to help make any decisions that you need to make if you haven't yet been vaccinated, that hopefully will lead you to move in the direction that, okay, I'm a lot more comfortable now. I'm okay getting vaccinated, and I'm going to go ahead and do it. I will tell you, as the mayor of the city, and technically, I guess, the boss for 3,500 employees, it pains me to learn when we have employees that test positive, become ill, and as has happened within the last month, to lose a current employee and an employee who had just retired, both of whom were unvaccinated, both of whom got COVID, and both of whom passed. And from my perspective, those are deaths that could have been avoided, that should have been avoided, and that we need to do everything we can to try and avoid. We don't want to lose anyone. You all are too important to not just the city, but more importantly to your families and to your friends. And if there are things that you can do to make sure that you don't put yourself at risk, you don't put your family at risk, you don't put the community at risk, and if it's just getting better information or getting your questions answered, that's what we hope gets accomplished here today. So I appreciate you tuning in. I want to encourage you to stay for the entire time and get as much information as you can. And I really, really hope you will make a decision to go ahead and get vaccinated. Do it for yourself, do it for your family, do it for your friends, do it for your community. Thank you all.
Okay, thank you, Mayor. This is Chris Guella. I'm the Human Resources Director. I want to welcome all of you, especially to our esteemed panelists. Just a couple of items I want to touch on to tack on to what Kim informed you about putting your name and your employee ID number in. Please save that for the end of the discussion. Instead of doing it now, we want to capture that at the end to make when the program has ended. So thank you. I will serve as moderator, asking some questions and keeping the discussion flowing along. But right now, I'm going to turn it over to our healthcare providers here. They are going to touch on the aspects that the mayor discussed about making you more comfortable with vaccines. And there may be still some questions that are unanswered. I have a good list that was provided by you employees. So at the end, we will cover those questions that weren't covered during the presentation. So with that, I'm going to turn it over to our doctors and let them begin their presentation. So thank you.
Hey, good afternoon, everybody. I'm Dr. Ulyee. I'm the director of the Florida Department of Health in Pinellas County. I don't know if my colleagues would like to introduce themselves.
Hi, I'm Dr. Israel Wojnowich. Many of you know me here at the City Employee Health and Wellness Center, and it's an honor to be able to share our thoughts with you all today.
Hi, my name is Dr. Angus Jameson. I'm the Pinellas County EMS Medical Director, and thanks for having me today.
Okay. Well, I want to welcome and thank you all for joining us on the call today. Our focus today is to talk about some of the information that is out there regarding COVID vaccine specifically. We do feel that COVID vaccine is the best line of defense to really get past this pandemic. And I know we've been battling this for the past year and a half. And certainly we are tired of it. The one way to really end it and completely put it in our rearview mirror is to just get enough people vaccinated. Vaccines are safe and effective. And today we're going to talk a little bit on the background, effectiveness, side effects, some of the misinformation out there, and then take any questions you may have. So I want to touch real briefly on the current situation. We've seen a surge of cases and hospitalizations due to that more contagious Delta variant. I think everyone knows that. One of the questions that I do get a lot is mutations on how the virus mutates. For any virus, mutations do occur pretty constantly. Most of the time, it's inconsequential. But if you get the right combinations of mutations together, it can form a variant such as the Delta that is more transmissible, more severe, and able to evade the immune system. Locally, we are at the highest cases and percent positivity compared to any time during the pandemic. It really shows how contagious and transmissible that Delta variant is. And with only a little more than 50% of our total population completely vaccinated, we still have that large segment in our population that remains unvaccinated and remains vulnerable for COVID-19 infections. And certainly we have seen that increase in the hospitals, in our EMS systems. And I'll pause there, Dr. Jameson. I don't know if you wanted to add anything there in terms of some of the trends we're seeing.
Sure, thanks, Dr. Choe. Yeah, we are definitely seeing an increase in 911 calls for people with COVID-like symptoms, more than double where we were a few weeks ago in terms of the percentage of our calls that are potentially related to COVID. We're also seeing, I don't just work at the EMS system, I also work in an emergency room, and we are seeing more COVID patients really than we ever have before in there. They're younger than they used to be as well, and I think that's an important thing to remember, that while these numbers are rising significantly, they are rising primarily in the 20 to 50-year-old age group rather than the older folks that were earlier in this pandemic. So we certainly are at a very different spot than we were early on. And I think the Delta variant has really changed the game on this.
Appreciate that. Okay. Let's give a little background in the history on how these vaccines really came about. In 2020, the federal government put into place something called Operation Warp Speed. And what that was a partnership between the Department of Health and Human Services, the CDC, NIH, and the Department of Defense. And essentially what the federal government did was direct billions of dollars through supplemental funding for the development of these vaccines. The government assumed financial risk for manufacturing and distributing through a network of partnerships, and for the most part, it sped up the process. Now, that term Operation Warp Speed may invoke in you that it was rushed or it was done too hastily. I can assure you that they did these studies the same way they do for any other vaccines. They had sample size and participants ranging from 30,000 to 40,000. They went through the same phases of testing, phase 1, 2, and 3, like they do for any other vaccines. And the studies, again, have been found to found the vaccine to be both safe and effective. Additionally, they use technologies that are not new. The mRNA technology that the Pfizer and the Moderna vaccine incorporates, and the viral vector technology that the Johnson & Johnson vaccine incorporates are not new. They've been around for the past few decades. Now, currently, there are 3 vaccines under emergency use authorization, those 3 that I mentioned, Pfizer, Moderna, and Johnson & Johnson. Now, in a public health emergency, such as the COVID pandemic, manufacturing and approval of the vaccines can be streamlined. This does not impact the development, i.e. the clinical studies, looking at some of the side effects, the effectiveness. It just merely speeds up the manufacturing and administrative processes. All the vaccines follow essentially the same, again, as I mentioned, the same testing processes that we do for any other vaccines, whether they're under the EUA or under the typical license or full FDA approval. And in fact, the Pfizer is currently applying for full approval, and the latest thing that I saw that they are looking to get fully approved by sometime early next month.
Dr. Choe, can I address the speed thing a little bit? Because this is a question I get an awful lot. A lot of people feeling like this came out really fast. Um, so as far as warp speed goes, it was really primarily the government helping with financial risk. And it's interesting to note that Pfizer and Moderna took very different approaches to the warp speed. So Moderna had some support from the government in terms of actually funding the research. But Pfizer actually only had a prearranged purchase agreement with the government. So Pfizer actually independently conducted the research, and they really came to the same spot almost at the exact same time, which to me is kind of reassuring that there was really no chance that the government funding was influencing that development process for Pfizer.
That's a good point, Dr. Jameson. Let's next talk about some of the effectiveness of the vaccine. So again, as I mentioned, they did that rigorous studies. They did the same phases they do for any vaccine. And the original studies were very promising. We were very pleasantly surprised that the effectiveness for Pfizer, for example, was 95% effective in preventing COVID-19, which is more effective than most of the other vaccines out in the market. The flu sometimes is only about 50%. The pertussis shot's only about 70%. Mumps is only 70%. So this was what they found was one of the most effective vaccines out there. But more importantly, both the Pfizer and the Moderna was close to 100% effective in preventing severe outcomes. And let's not lose sight of the main purpose of the vaccine. It's not to prevent every type of infection. It's to prevent hospitalizations, severe respiratory complications, and even death. And these vaccines consistently do show that effectiveness. Now for the Johnson & Johnson, what they found in terms of effectiveness was about 66 to 72% effective in preventing symptoms, but 85% effective in preventing severe complications. Now we do have a little bit of a different animal in the Delta. It does evade these vaccines a little bit more than the original strain. With the Delta, however, vaccines are still found to be effective. It's 49 to 66% effective in preventing symptoms, but more importantly, again, 90% effective in preventing severe outcomes and hospitalizations. And while we have seen breakthrough cases, meaning that someone's fully vaccinated and then gets reinfected, gets infected with COVID, we can tell you that for the majority of those cases, the vast majority are either mild or asymptomatic in terms of COVID-19. Now, in terms of, okay.
Oh, sorry. I was just going to say, that's not just a theoretical concept. In the hospital right now, the vast majority of the people that are hospitalized are unvaccinated. There are a very few vaccinated people in the hospital, but the vast majority of people that are in there are unvaccinated.
Absolutely.
Well, and I'll add to just, press upon the point of the severity of Delta relative to the other strains prior to this, is that colleagues of mine in ERs, especially in hospitalists, intensive care specialists in the hospitals, are seeing these younger people presenting with severe illness a lot earlier in the course of illness than was found to be in the early stages of COVID. Meaning, whereas we used to see changes on X-ray or in clinical status 7 to 10 days into the illness, they're seeing patients with X-rays that have changes consistent with COVID pneumonia by day 3. So again, it impresses upon us, the severity of this strain in particular, and any attempt we can have to sort of blunt its severity vis-a-vis a vaccine is definitely the best medicine out there at this time.
100% agree. I admitted a healthy 50-year-old on day 4 requiring oxygen last night.
What's also concerning is the long-term effects. This is still a relatively new virus, right? And we're still learning more about it every month, every day. But the long-term complications of the viral infection in itself is yet to be determined. There were studies that showed that 1/3 of people that were infected with COVID-19 developed either a psychologic or neurologic complications. There's the fatigue, there's the cloudy brain cloud, fuzz, the loss of sense of taste and smell. It has been prolonged for a number of people as well. Okay. Next, I do want to talk about some of the side effects. So when, and my colleagues can attest to this, when you're looking at any medication, when you're looking at any vaccines, as a physician, you want to look at both the risks and the benefits. I can tell you that with the COVID-19 vaccine, that most physicians believe that the benefits of the vaccine outweigh the risks if you were to contract the virus. There was a process put in place by the FDA to add that additional months of the study period to look at the side effects. And the majority of any other vaccines that were produced in the last few decades, any severe complication manifested it and showed itself within 2 months. And certainly we have more than 2 months of data on that regard. So some of the common side effects once you get the vaccines includes fatigue, headache, muscle pain, chills, joint pain, injection site pain, as well as some lymph node swelling. What makes the news, however, isn't necessarily the common side effects, it's the severe side effects. The severe side effects, you have to keep in mind, is pretty rare, but there has been some case reports. For example, for Pfizer, they showed that some rare cases of myocarditis, of those cases, most recovered with supportive care. And what they found is that the risk of inflammation of the heart, the myocarditis, occurred more frequently at higher rates when you got natural infection. And similarly, the Moderna showed the same thing. For Johnson & Johnson, it also, there was some reports of blood clots, but I can tell you with the natural infection, there has been cases with blood clots in various parts of the body as well. So again, those rare side effects are seen more often with natural infection.
Could I make a point about those real quick? So I think it's important to use the right words when we're talking about these things. A side effect, like we were talking about with headache, fatigue, muscle pain, those types of things. Yeah, it's a side effect, but it's actually the immune system turning on. And that's what we're asking it to do with the vaccine. So we're asking the immune system to learn something. And those are the same things you feel anytime your immune system turns on. And so I sort of struggle calling them side effects. I mean, they are doing what we're asking the body to do. We're training your immune system to recognize something new and be able to mount a response. And that involves activating the immune system. That, I think, though, is very different from what might be better called complications. And those are sort of unintended consequences of a medication, and in this case, a vaccine. The biggest one I hear about is this myocarditis. And, you know, I've read a lot of stuff on this, and I recently asked the person I trust most when it comes to cardiology, a doctor up in Maryland, and he said it to me this way. He said, the incidence of myocarditis in the general population is 1 in 20 million. The incidence in myocarditis among those receiving the vaccine is 1 in 40 million. So there's really not something there. This vaccine has been watched so closely that we all almost remember those 2 nurses over in Ireland who got an allergic reaction right at the beginning. You've never seen a vaccine get watched that closely in the past. And it turns out after months and months and months of watching people for 15 or 20 minutes after giving the vaccine, it's not really that big a thing either. So I just think it's important to sort of distinguish between your body doing what we're asking it to do by training to learn something new, and those types of things that are just your immune system turning on and engaging, versus potential actual complications. And from everything I've seen, the risk of complications from the mRNA vaccine specifically is just vanishingly small and absolutely outweighed by the risk of complications from COVID infection. As it comes to the heart, I mean, we have case series of NCAA athletes with significant cardiac issues after infection. And you just don't see that with the vaccine. So it's very clear to me that although we're watching closely and you're hearing all sorts of things being looked at in the news, when it comes right down to it, the complications are just so rare as to be way less of a risk than actually getting COVID.
Thank you, Dr. Jameson. I couldn't agree with you more. And certainly just working in the hospitals, we have seen we have seen a lot of cardiomyopathy, heart failures as a result of a natural viral infection. I see that all the time in the ICUs during my rounding days with the viral myocarditis and pericarditis. Those are common occurrence that occurs with viruses, and the vaccine is essentially protecting you from those types of rare outcomes.
I'll just add at all children's hospitals, I'm hearing case reports of children with encephalitis, which is inflammation, infection, of the brain, again, caused by the virus itself. At this point, right now, vaccines are approved for 12 and older. Hopefully soon in the months ahead, we'll get that approval for younger. But with school starting in the weeks ahead, it's an imperative to get as many people vaccinated to protect our kids from getting it from one of us, from their parents, from their parents, friends, from any outings that they go to. Because if they do get it from us, there is a chance that they could get very sick and end up in the hospital. So again, we have to think about the downstream effects that we are minimizing by getting a larger population group, that herd immunity, vaccinated.
Absolutely agree. Let's move on. I'll touch on some of the common myths out there, some misinformation, but it's sometimes hard to prove a misinformation if they're not coming to you with some of the data and the facts on that misinformation. But it certainly has been one of our biggest challenges throughout the pandemic, the misinformation, the disinformation out there. I was interested to see one study that showed that only 12 online influencers were responsible for 65% of the misinformation out there. So that stuff is being perpetuated, and some of the stuff, at least us on the medical community, has struggled with. Some of the common ones that I'll mention here that I've heard in terms of misinformation is that the vaccine contains a microchip for government tracking. That's not true. I think a number of experts have said that, even in the technological field, that the microchip chips are too big for it to even fit in a syringe needle. The COVID vaccine contains metals and other problematic ingredients. The FDA and the EUA contains all the ingredients for any of the vaccines that receive that approval. So that is not true. The last thing I heard was something called graphene oxide that hasn't been disproven as well. And then on top of it, if you think about it, I think you need a mass spectrometer to determine if there's any types of particles that are to break down what the particles are in a particular product. And there's several mass spectrometers throughout the country. So the idea that you only found this graphene oxide in an undisclosed lab in Spain, it just, some of the stuff you have to look out there. And then I do encourage, if you come across some of the misinformation, to do some of the, even if Google it, there's the fact checkers and stuff like that to sort of inform yourself and protect yourself against some of the misinformation out there. It doesn't alter your DNA, and I don't need to get into the specifics. It just doesn't go into the nucleus. It doesn't touch the mRNA vaccine, doesn't touch the DNA. The biggest one that keeps coming up to me is, and as a parent, I can understand this, is the vaccine shunts fertility and disrupts pregnancy. I've seen that a lot, but what the experts are saying is that the proteins from the vaccine and on the placental cells are not similar enough to confuse the immune system. There's no evidence that the COVID vaccines cause any problems with pregnancy. In fact, the governing body of the OB-GYN doctors, the American Academy of Obstetrics and Gynecology, strongly recommends vaccines even if you're pregnant at this time. But certainly, I encourage you to question any information you have, and if you have any questions, please feel free to talk to your medical provider. Okay. So last few points for me, and I'd like to take 20 questions and then turn it also over to my colleagues for any additional comments. But I encourage you really to, again, to speak to your medical provider to answer any questions you may have. But also talk to your family and friends. You obviously know somebody that's been vaccinated. Talk to them about their experiences, their decision-making process, some of the symptoms they may have encountered with the vaccine. What was encouraging to me is that the American Medical Association released a survey they conducted among the physicians, and what they found was 96% of practicing physicians who have been fully vaccinated. These are the people that have done the research, that have trained for multiple years on medications, on vaccines, and 96% of these physicians are fully vaccinated. So that does say something to me. And on a personal note, I can tell you my 14-year-old son was vaccinated, and I plan to vaccinate my 2 girls that are under 12 once finally approved. So as a public health official, a physician, and a parent, I urge you to step up and protect our community by getting vaccinated today. We'll take, actually, let me turn it over, Dr. Jameson, Dr. W.
As I stated today in front of City Council, we are all benefactors of the power of vaccines in our lives. We are not living with many diseases today because vaccines have been effective over the last 70 to 80 years since their development. So again, getting back to Operation Warp Speed, this is some of the oldest technology, oldest medicine that we have, and we know how they work. We know that they're effective. It's because of vaccines that we don't have measles, mumps, rubella running around the city. We don't have to deal with polio in almost throughout the world. There are certainly pockets in the world where just vaccination and public health is not as strong as we are fortunate to have it here. But this is all to the credit of vaccines. And here's one more, pandemic, one more virus that has come to affect us, and we can also put a stop to it, if not for the long term, in terms of, it will not die out, it will not disappear. We will be living with COVID or a variant of it for years and decades ahead. But the vaccine is how we slow down its transmission. The vaccine is how we get back to living life as we once knew it. And the vaccine is how we save lives, how we save people from dying from the serious consequences of illness. So please be thankful for the vaccines your parents gave you growing up. Be thankful for those you gave your kids to keep them healthy as they got older. And please do the same for yourselves and those you love.
Well said. And I just would add, I am working shifts in the emergency room right now, and the difference in what I see among vaccinated people that come in and unvaccinated people that come in is stark. And it's to the point where it's almost upsetting, frankly, to see unnecessary suffering and unnecessary illness in otherwise young, healthy people in their 30s, 40s, and 50s that shouldn't be sick like this and don't have to be sick like this. There's a way we don't have to do that right now. And, I wouldn't be honest if I said I wasn't frustrated by seeing that unnecessary suffering. And so I can't say it enough. Protect yourself. There's something you can do. You don't have to suffer like that.
Well, again, I thank everyone for the time. I'll turn it back over to our moderator for any questions.
Okay, thank you, Doctor. So it was very informative. And as I suspected, you did answer many of the questions that were posed to us, but there are still a few out there that I think we might want to touch on. And so I'll start with vaccinations. Is there any data regarding mortality due to COVID vaccinations?
There is. I don't have them on hand. It was minimal for that. And obviously, if you take it in the context of the mortality rates of what we saw in COVID, I think there's a stark contrast. The one data statistic that I will share is this, something I shared really through the beginning of this year, because the disheartening thing to me with the COVID epidemic and pandemic in 2020 is that it caused a significant increase in all-cause mortality. There was a 16.5% higher in that all-cause mortality when compared to the average of the previous 3 to 5 years. So that's significant. And you probably also saw the study or some of the reports released by the CDC, and what they did show, there was a loss of 1 to 1.5 years of life expectancy from COVID in itself. And I can tell you the minimal, any complications or from the COVID vaccines, and has paled in comparison to the larger outcome of the COVID infection.
Okay, very good. Thank you. Are there some duration statistics for the vaccines? You know, how long they typically last? Is there any good data to share on that? And in particular, with Pfizer, Johnson & Johnson, Moderna, and perhaps even BioNTech?
So those studies are ongoing. What some of the studies are showing is that the further you get away from the vaccine, whether it's 6 months or 8 months, you start seeing a dwindling of some of your antibody response. So they are studying that, looking at recommendations for boosters. So there is that chance that boosters will be a possibility in the future because of that reason. But that recommendation isn't out yet. Obviously, for anytime you give a vaccine, those that are immunocompromised, such as those on chemotherapy, those with the organ transplant, it's harder for those individuals to develop an antibody response because they already have that suppressed immune system. So in my mind, I think they will be recommending that booster shot for those individuals first here in the US.
Okay, another question. Could these vaccines be helping the virus mutate as fast as, say, an influenza mutates? Is there any data to support that?
So all viruses mutate constantly. There's a couple different mechanisms that they do it by, sort of in the same way that your genes can mutate and you end up with certain cells that have different DNA and can lead to diseases, but all viruses are constantly mutating. I do think that having a partially immunized population actually does put evolutionary pressure on the virus to come up with meaningful mutations. I like to think of it kind of like if you get a sore throat or some other little infection and you get prescribed some antibiotics, you don't take half the course of antibiotics or stop taking them, you know, the day you feel better. You might feel better on the second or third day, but you take the full week of them. And the reason you take the full week of them is so that you don't, again, promote the development of resistant bacteria that can get around the antibiotics. So, you know, it's part of life that everything's trying to survive, and there's always going to be mutations going on. The flu virus and the coronavirus have slightly different mechanisms for their primary mode of mutation. But yes, if the question is being in a half vaccinated state could potentially put evolutionary pressure on the vaccine or on the virus, I do think that's true in the very same way that taking half a course of antibiotics promotes drug-resistant bacteria.
I can also add that throughout the pandemic, we actually have been watching the variants, the different variants out there. The CDC does delineate between variants of interest and variants of concern. So you can visit their website to read up on it a little bit more. This was one of our bigger fears when we talked about this in the past, is that there may be that potential that this variant that is more transmissible, it could come around with the constant mutations, since this is a pandemic, and they have that opportunity to mutate, and Delta was such a viral strain. And the concern that I have is that something that we need to always continue to monitor for is what is going to be the next potential strain, and what are some of the characteristics that are going to be more transmissible? Will it further evade the immune system or vaccine response? So that is something that from the public health side, we're going to continue to monitor.
Okay, thank you. With regard to the Delta variant, is there a higher risk for unvaccinated children with the Delta versus COVID before Delta?
I'm not sure if the data is completely clear on the severity of it, but let's say at worst, or in the best case scenario, they were about equal. The difference between the Delta and the original strain is that the variant is that it's more transmissible. So if you have a bigger sample size where more people are infected, then you're going to, by sheer numbers, have higher rates of hospitalizations or other complications and even death, just by that characteristic alone. So I think I would say just because, and just to go over, and you may have read some of it out there in the media, but the biggest concern I have with the Delta is that the sheer viral load that the body contains, that they think it maybe is just as transmissible as chickenpox. You can walk and talk real briefly to somebody standing at your door, and you can get that virus. And the reason is that there's 1,000 times more viral particles than the original variant. So it makes it that much more contagious. So if you think about it, if you get more people infected, you're going to see just by total numbers more complications.
Okay. Thank you. Next question is there any data about the vaccine related to infertility?
Oh, no, so yeah, I touched on it real briefly. There is no data. It's part of some of the most common and the most frequently asked misinformation out there. There is no data to prove that they cause infertility. And some of the preliminary does show the contrary, actually, for both men and women.
Okay, great, thank you. And if somebody had COVID, are they as immune as if they got vaccinated, or is a vaccination still recommended for somebody who actually had COVID?
So currently, the CDC does recommend that you get the vaccine, even if you had natural infection. And one of the reasons is that is how much exposure you got with the natural infection and your immune response to it. What a vaccine does is give you a consistent amount of introducing your body to that antigen, so your body can develop that consistent antibody response. And Dr. Jameson can speak on this, and Dr. W maybe, is that we have seen a number of cases where someone had natural infection, then got reinfected with COVID-19.
Absolutely. I mean, we see that here quite a bit. The body also has multiple pathways to develop immunity, and the ones that the vaccine triggers are not exactly the same as the one as if you got an infection in the real world. So it would only, behoove you to get that extra pathway, those extra cells that are, responsible in terms of activating your immune cells, activating these antibodies to neutralize infection in as many ways as possible. Again, I would rather, for those that are healthy, the best way to do it is vaccination. You would never want to go down the road of having to get sick first to get immunity if you could prevent it.
Yeah, I would agree. I've seen plenty of patients on their second round of COVID. A lot of the time it's a variant versus the first one, so Delta versus Alpha. Not always, but I've seen a lot of that, and to the point where I would sort of tell people to almost consider the Delta a new one, and that just because you had an infection with the original strain does not mean that that gives you significant protection from the Delta. We've just seen that over and over again. And so I would say the absolute best place you could be from an immunologic protection standpoint is probably have recovered from natural infection and also get the vaccine. I think from have as much of an immune coverage or protection as you can, that's probably the best. Now, obviously, I'm not advocating to get infected in order to develop that immune coverage, but if you had previously been infected, I would absolutely still recommend getting the vaccine. I think it's very clear it strengthens your position in terms of protection.
Okay, great, thank you. So for an individual that already has immunity deficiencies, how does the vaccine affect them in particular? If there's anything to support that it's different.
I think I touched on this real briefly, but anyone that has immune deficiency, their body just doesn't have the ability to generate the antibody response compared to somebody with an intact immune system. So for those individuals, it's important, even if you're immunized, to take that extra precaution. CDC recommends masks, social distancing, certainly somebody that's immunocompromised, whether they got the vaccine or not.
I like to think of it like the vaccine is a trainer at the gym, and you're trying to build up strength, right? If you are a young and a strong person and you go in for a training session, you're going to see some good results from that. You're going to probably be a little sore, just as you are with the vaccine potentially, but you're going to mount a good response to that because you're going to be able to do a very rigorous workout. On the other hand, if you're somebody who's a little bit more frail, so i.e. somebody whose immune system doesn't function quite as well as a normal immune system, you might not be able to mount quite as much of a response to that instruction that the vaccine is giving you, or that training that it's giving your immune system. So you wouldn't necessarily get as strong or be able to have as powerful a workout. And so each time you get a dose of this vaccine, the first and the second dose, it's like going and working out again to build up that strength. But if you can't do a very vigorous workout because your immune system isn't really a normally functioning immune system, then you're not going to get as strong from that same workout. So it's really not that there's any contraindication or issue with getting the vaccine if you're immunocompromised. It's only that your immune system might not be able to mount as good a response, and therefore you can't really count on having as good a defense built up from the vaccine. But there's no reason why an immunocompromised person shouldn't get the vaccine. In fact, they absolutely should get the vaccine more than maybe anybody else.
Okay.
Okay. Very good. We have a series of questions here that related to vitamin regimens and doing daily flushing of nostrils and wearing masks and washing hands. Is that a good defense on its own compared to a vaccination?
If I had $1 for every patient in the last couple of weeks that told me they thought their immune system was healthy and they took care of themselves and took vitamins so they didn't think they were going to get it, I could take a vacation. That's just not the way this works. Yes, having a good immune system, getting good nutrition and good vitamins are all very important. I'm not saying it's not. It's absolutely important for your overall health and your ability to fight off diseases. But taking some extra vitamins will not prevent you from getting COVID if you've been exposed to it. Literally, if I had $1 for every time I've heard that in somebody I've just diagnosed with COVID over the last 2 weeks, I could take that vacation I've been wanting for the last 2 years.
Okay, very good. I think that pretty much took away about a half a dozen questions related to other home defenses, humidifiers, hot teas, and hot beverages, things of that nature. So there really aren't any natural protections for this.
So I should give a slightly more nuanced answer, which is that some of those protective measures, whether it's washing your hands or wearing a mask or practicing good hygiene, are absolutely important. But there is nothing that you could do in that realm that comes close to the protection that a vaccine will give you.
Okay. Very good. Thank you. And last on the vaccine, we do have a question about let me open up the chat. I believe we have a few in there. One in particular, are the vaccines still considered experimental? Or can you explain the difference in the approvals?
Okay. So yeah, we touched on this as well, but happy to reinforce. But it's under emergency use authorization. And again, it doesn't mean that it didn't use the same safety protocols, the same procedures that they had to approve any vaccines. It was never experimental. So that in itself is a misnomer. It's received its emergency use authorization. And if you're sick from COVID, you're gonna receive a drug called remdesivir that's also in EUA. So a lot of these things that we came out to treat and prevent COVID right now is under the emergency use authorization, given the fact that we're under a pandemic. And as I also mentioned, at least for Pfizer, they do plan to, and hopefully we'll get a fully FDA approved in the beginning of next month at the latest.
Okay, thank you. The only questions remaining are more for City of St. Petersburg management with regard to policies. So I'm just going to call these out. We've had questions about working from home still, telecommuting, confidentiality and privacy of records, and how workers' compensation might fit into all this. Those questions the city can answer, and we're not going to have the doctors don't have the expertise and shouldn't be put on the spot to address city policies. So those questions can be directed to city personnel. So I just wanted to make that clear. So that ends it for the questions. Is there any parting words from the group?
Yeah, I'd just like to say these were not rushed. They were not rushed. Due diligence was done. There's a lot of reasons why they came faster than maybe some vaccines in the past. For example, when you do a vaccine trial, you give a bunch of people your proposed vaccine, and then you watch them and a bunch of people you didn't give it to, and you wait to see cases accumulate in both groups until there's a big enough difference between the groups. And if you have a very rare disease, that's going to take a long time. And thankfully, most of our vaccine treatable diseases are very rare. And so that might take a few years of watching to get enough cases. But we've got COVID cases all over the place, and it doesn't take very long at all to see a clear difference between the vaccine and the control group. That's one reason. The financial risks that the companies and or the governments took on is another reason. And the fact that the technology came together at exactly the right time, technology that had been in play and being developed over years. These vaccines are so much more safe, so much more elegant, so much more of a refined solution to train your immune system on how to do something than any previous vaccine we've had. We're not infecting you. The mRNA vaccines, we're not infecting you with anything. They're never even going anywhere near your cell nucleus. It's no other virus. It's simply a little piece of code that teaches your body something no different than printing a letter on your computer. We know how to read mRNA and DNA and all that stuff now. And the science has progressed so far that I don't think we'll probably ever go back to the old way of making vaccines. I can't imagine we would. These ones just seem so much safer on every level that I don't think we'll ever go backwards. And it's really fantastic that we got there just in the nick of time. But these were not rushed. These are elegant. These are a better solution than we've ever had before, and will continue to serve us well, I think, for many, many years. I hear lots of things among the patients that I'm seeing in the ER and diagnosing with COVID. And I just wish that folks would be very thoughtful about where they get their information and who they choose to rely on as they make their decisions. It's just sad to me when I see people who make a decision based on information that's just clearly from a source that's not scientific or peer reviewed. I just hope people will be cautious about where they get their information and what they choose to trust, and make a good informed decision for themselves.
Great, thank you. And just to be clear, there was a question. These vaccines did not involve gene editing. Is that a true statement?
Not to my knowledge, and I'm familiar with one of the CRISPR technology to some degree. That's the editing and insertion. They are doing some research on that with some metabolic diseases. To my knowledge, the mRNA was developed separately from that, and certainly if the implication is that the mRNA can incorporate like the CRISPR technology, that's not the case. And again, we can get into the nuance, but the fact is that it cannot alter the DNA. If it's going back to that as a mechanism for altering DNA, there is no evidence of that. There was another question I see on the chat that is pretty good in terms of research, and Dr. Jameson touched on it as well. I saw one of those memes, and there's a million memes out there, but I sort of like it, so I'm going to read it here. Science is not the truth. Science is finding the truth. And when science changes its opinion, it doesn't mean it lied to you. It's learned more. So if it's what we have seen throughout the pandemic, and keep in mind, when you look at cancers, when you look at other infections, we have decades to study. We know the best drugs to give that are available for heart disease, that decrease in mortality. We had decades to study this. With COVID, we've had less than 2 years essentially to study it, and the research is nuanced. That's why I would defer to some of the experts that are out there And Dr. Jameson, who's also done a lot of research, bench research in the past, the research in itself is complicated. I think I took a year's course on how to interpret data, statistical significance, p-values, confidence intervals. So we took courses on things to how to interpret some of the research out there, how to delineate if it's statistically significant. And what the problem is that social media just puts information out willy-nilly without any of that analysis conducted. So I think that's some of the frustrations that we have, that you have to understand the research and what is the significant research that is out there and how to interpret it. And I would defer to some of the experts, the CDC, scientists, the doctors. And again, going back to my earlier statistic, 96% of the physicians have gotten their vaccine. So again, that says something to me.
Yeah, could I say that another way? Because I 100% agree with you, Dr. Choe. Normally, so I tell my medics, we would never change a treatment protocol about how we take care of a stroke or a heart attack or anything else based on one study. We never would. Over a period of years, we would take 10 studies, and if 8 of them point us in one direction, we're going to think that that's probably the right answer. But what we've seen over the last 2 years is, frankly, the scientific method play out on the nightly news. And normally that plays out in scientific journals and with nerds like us at conferences. And so the public doesn't really see that. They see a decade later, a new treatment is approved for something, because for the last decade, ideas have been competing against each other and the best ones rise to the top. And at the end of the day, that's science. That's the scientific method. I have an idea and I throw it out there, and somebody else has got to validate that idea before we believe it. Back in high school, you used to write lab reports, right? And they would say, write your materials and methods section so detailed that somebody who never met you can replicate exactly what you did, right? That's the scientific method. The whole point of that is I throw my idea out, somebody else has to verify that idea. But instead of that happening in journals and conferences over a period of years, for the last year and a half, every night on the nightly news or on Facebook or wherever, there's a new study that came out that showed this. And tomorrow, a study comes out that shows something completely opposite. Now, normally, that's good. We want to see those ideas compete and the best ones rise to the top. But when people are scared, when time is short, and when something new comes out every other night, that's playing out in the public. It's a messy process. It's supposed to be. It's supposed to be a competition of ideas till the best one comes to the top. And I don't think people are necessarily used to seeing that, because again, usually it happens at professional conferences and stuff like that. And so that messy science process has been happening in the public eye for the last year and a half. And, no wonder people don't know what the heck to believe, because one day I saw something and the next day I saw something completely different without that benefit of time and thoughtful consideration, and debate. And so I would agree with you, Dr. Choe. Just look to somebody who's spent a lifetime or a career interpreting these various studies as they come out to help make sense of it, and be cautious about any one study or one thing that you read. Really, ideas should be tested by multiple sources before we think that they're pointing us towards the right answer.
Okay, thank you. And that takes us right to 5 o'clock. We had planned an hour for this, so I think we can wrap it up at this point. And once again, I really want to thank Drs. Choe, Jameson, and Wojnowich for your contributions. Very much appreciated.